My passion is really in the area of injury and violence prevention, especially for youth and in communities of color. Violence is a disease. It's a public health problem. So just like in infectious diseases, one would look at the patterns of disease. I look at the patterns of violence. I look at the risk factors. I look at prevention strategies, what interventions would work to help prevent and respond to violence so that we can reduce the impacts of violence on individuals and communities. We need to engage with our partners in order to develop strategies and protocols that include their voice, not only as data collection participants, but as partners who help us identify what are the important research questions, what data collection methods are going to be feasible and acceptable. In 2007, after the Great Flood of Iowa, I partnered with a large school district in Cedar Rapids, Iowa. And together, we worked with a mental health professional and developed the first program of LINK. We trained a school nurse on a program of psychological first aid that integrated skills in motivational interviewing. And we found that after one session of psychological first aid with a school nurse, that children who had traumas had reduced symptoms of post-traumatic stress and reduced symptoms of depression. In 2019, my colleagues and I were awarded a grant from the National Institute of Minority Health and Disparities to implement and test LINK for Equity as a program that would address violence prevention as well as discrimination among students of color. And we were able to train 6 schools throughout the state of Minnesota in this program of LINK for Equity. We're seeing improvements in racially biased attitudes among staff, also reduction of post-traumatic stress symptoms, increased connectedness with an adult at school, and reduced symptoms of depression. It's a community engaged process that we want to train the staff at the school to be the interventionists. If we are not understanding of these impacts of trauma or trying to intervene on them, then we're continuing to perpetuate this problem.